Tonight, my first guest is Dr. Sean McKenzie, who is an oncological surgeon, a cancer surgeon, and you're also the medical director of the Baptist Cancer Center.
That's correct.
Welcome.
Thank you. It's great to be here.
Well, recently on television, Alex Trebek, the host of Jeopardy, said, told us all he's got pancreatic cancer.
Right.
That's something you deal with, I'm assuming, as a surgeon.
Yes.
Tell us, what is the pancreas to start with?
The pancreas is an organ in your digestive system that helps you digest food, and it also helps you control your blood sugar. It releases insulin and hormones to control blood sugar.
Well, it's not that common of a cancer, or is it?
It actually, unfortunately, while it's not a very common cancer, it accounts for about 3% of cancer deaths or cancer incidence in the country. It's the fourth leading cause of cancer death in this country. And in 2020, it looks like it may become the second leading cause of cancer death in this country. So not common, but lethal.
Who's at risk for it?
Typical risk factors, known risk factors are smoking. Long-standing diabetes has been shown to be a risk factor. Chronic pancreas disease has been shown to be a risk factor. And then obesity also is a risk factor. Also age, it is typically diagnosed in older patients.
So all those things that are bad for you, diabetes, smoking, drinking,
Right.
Can lead to that. Now, there's a difference between pancreatic cancer and pancreatitis.
That's correct. Pancreatitis is an inflammation or an irritation of the pancreas. There are numerous causes. Pancreas cancer, of course, being a cancer that comes from the pancreas. But then again, if you have a history of chronic pancreatitis, that is a risk factor for pancreas cancer.
What's some of the symptoms that you might think, oh, I better get this checked out?
I think that's the hardest thing about pancreas cancer. It's difficult to diagnose because the symptoms are very vague. Typically, upper abdominal pain that often radiates or spreads through the middle of your back is a common complaint. Some patients will develop jaundice or yellowing of their skin and eyes because of blockage of their liver function. Weight loss that's unintended. And then something else that's important to remember is if you're newly diagnosed with diabetes over the age of 50, especially without a family history of diabetes, that is a sign that you may be developing pancreas cancer.
Does it run in families? Is there a genetic risk to it?
There is, but it's small. That accounts for probably at most 10%, but more likely 5% of all diagnosed pancreas cancers.
Okay, so if you think you have it, you see your doctor, how do you make the diagnosis?
The diagnosis is made typically with multiple different tests. Imaging, whether it's a CAT scan of your abdomen or an MRI, can be diagnostic, but oftentimes a biopsy is necessary. Typically that's performed with a special type of endoscopy or scope that's passed down through your stomach adjacent to your pancreas.
Now, I guess we should say, though, that everybody who has abdominal pain doesn't have pancreatic cancer.
Absolutely not. Again, it gets back to, it is a relatively rare in the comparison to, say, breast cancer, prostate, and colon cancer. So, and the symptoms can be indigestion for a long period of time. So you shouldn't be running to the doctor and assuming you have pancreas cancer just because you have an upset stomach, but certainly a persistent pain that does not seem to improve, and if it's especially associated with weight loss, is absolutely something that should be evaluated.
So let's say you've got the diagnosis. What's the treatment?
The treatment is very dependent on what we refer to as the stage of the cancer, meaning to say, is it just in the pancreas, is it just around the pancreas, or has it spread to other organs? The only potentially curative treatment is to surgically remove the cancer, but that can only be performed in patients where the cancer is localized or maintained within the pancreas or close by. And unfortunately, that only accounts for about 25% of patients. The vast majority of patients have the type of cancer or the stage that Alex Trebek has, and in that setting, chemotherapy is the typical treatment strategy.
Well, that's, I guess, good news about treating it, but it's not always treatable, and palliative care is an issue.
That's exactly right. I think, one of the challenges with it, even when you're treating it, is the symptoms can be significant, and I think that palliative care, both in terms of patients who maybe are not healthy enough to have treatment, but also even in patients who are being treated to help with those symptoms, is an important part of the therapy.
It's great information. Thanks for coming in.